Hi everyone, this is Camila Brango for the Magner Center, and I'm here today with.
Dr. Tenya Blackwell.
Okay, Dr. Blackwell, could you please tell us a little bit about your title and the company that you work for?
So, I am the Director of Community Engagement and Research at the Arthur Ashe Institute for Urban Health. So, we're a nonprofit organization. We're located inside of Downstate Hospital. And like the great tennis player himself, Arthur Ashe, he contracted an HIV virus as a result of a blood transfusion. And so, not only being a great tennis player, he was a social justice leader. And because of his status, he saw the differences in how people of color or people without resources were treated in the healthcare field. And so, like Mr. Ashe, we continue with his legacy in addressing health disparities for low minority populations, immigrant populations. We deal a lot with health education in the community, health advocacy. We partner with the Office of the Brooklyn Borough President and also Downstate University in the work and the endeavors that we do. So we focus a lot on research, advocacy, and education.
That's amazing, especially for students. So could you tell us a little bit more about the internships that you guys offer?
So I lead the community outreach and research department, where a lot of our research is focused on community-based participatory research. And oftentimes you'll hear health departments or health providers come up with an intervention or solution for people who are sick or to improve people's health. But our belief is that through community empowerment, engaging with the community, having the community's voice at the table when decisions are made on what research is done in the community, what types of education methods should be given to a community. We like to hear if the resources that we're using are culturally competent. You know, we have a lot of a diverse array of cultures and ethnicities in Brooklyn, and so it's not a one-size-fit-all when it comes to providing health education. So we try to tweak it and tailor it specific to the community. We engage the community and make them advocates and champions of their own health. And that's the best way to empower someone to improve their health outcomes.
That's amazing. So what would you say are some of the qualities the students looking for internships should focus in first before going into the health industry?
Well, it's important to be a good communicator. It's important to be comfortable with people that may not look like you. It's important to be able to reach people where they are. We do a lot of work in barbershops and hair salons. And if you could imagine facilitating a health session in a barbershop or hair salon, you know, it's not a classroom, a structured setting. And so you have to be comfortable with public speaking is huge, and understanding research and understanding health outcomes. So we'll touch on various health outcomes, including HIV, AIDS, diabetes, cancer, heart disease, and of course these are all health outcomes that poorer minority communities face at a higher rate than many others. And so it's just important also to just have a hunger and a love for people and a hunger for knowledge, because, you know, the one thing about my job, I get to be a professional student. I'm always learning. And so that hunger is important to have.
That's amazing. That's beautiful. And lastly, what advice do you have for those students that just aren't sure if maybe this is the right path for them, but would like to actually pursue something to help people and make sure that they're doing it the proper way?
Yeah, I mean, the one bit of advice I would say is to never give up or to never stop until you're done. If it's the medical field, you know, the public health, you know, I'm a doctor of public health, and so my initial plan was to pursue an MD degree and go to medical school, and then life took me a different route, and so, but I didn't give up until I finished. You know, life will throw all types of blows at you. You know, your grades you may not perform in a way that you thought. You know, especially in medicine and science, you know, chemistry. I was a chemist for many years, and so I love chemistry, but I know a lot of people complain about chemistry and things that you have to learn. Everything is hard. You know, being a basketball player is hard. The hours they have to spend practicing and breaking ankles and things they go through, everything is hard. So it's not hard. It's just it takes perseverance and just never giving up until you're done. That's my biggest advice.
That's amazing. Thank you so much. I really appreciate it.
You're welcome. Thank you for having me.
Make sure to check out the My Career tab on the BC Navigator app, where you can track your career progress based on the amount of credits you've earned, stay updated on upcoming events from the Magner Center, and watch our videos for insight and advice on your career field.